awesome. Well, it's great to be here. I'm Michael, the host of Planetary Health First, Mars Next, and I'm super excited. We have a founder, startup founder, Sid with Novobeing. You want to go ahead and just quickly, briefly introduce yourself before we get going?
Sure. Thanks, Michael, for having us here. By the way, it's such a fascinating name of your company. I'm absolutely resonating with that. Yeah, my name is Sid Desai. I'm the co-founder and CEO of Novobeing. We're on a mission at Novobeing to help reduce stress, anxiety, depression, and just alleviate a lot of suffering that humanity is dealing with clinically validated interventions that are delivered through virtual and mixed reality. And that's a quick overview about our company. But my background's in technology. I've been in tech for the past 15 years. I'm an engineer, and I love solving, complex societal level problems with using technology. So that's what brought me here today.
Well, I think you've gone after the hardest thing, human suffering, and in healthcare, unfortunately, it's challenged. So, really super excited to learn more about your company, but also just want to congratulate you at the Health Innovation Pitch Party. Congrats! There was 6 companies there. All of you were winners, but there were a lot of other amazing companies that didn't make it to the top 6. Tell me a little bit about that experience. I didn't get to talk with you there. I was there. I was blown away. Share a little bit what you came away from that.
Yeah, I mean, it's such a fascinating event. I think there's a growing community of startups and innovation that are kind of popping out in the North Carolina, Charlotte region, and that's where the event was. And I think it brought together almost over 100 people. It was a live pitch in front of not just an audience, but a panel of judges. And so we received immediate feedback on our pitches and just our overall strategy and business. And it was just a fascinating event. There's a lot of fantastic questions that were asked. The energy in the room was amazing, and I think all the other companies, including us, I think everyone did a phenomenal job. And it's really cool for me to see there's so many companies out there that are solving, different aspects of human health in just different ways. And I think that fascinates me that there's still people out there who are working and living a mission and sort of sticking to their guns about certain hypotheses and trying to solve, trying to crawl through mud, as our healthcare systems are, and try to get the solutions out to more and more people and help and support people. So it was exciting. It's great. I'm super glad that we got selected out of an applicant pool of, I think, over 100. So
Mhm.
super grateful for that. Yeah, it was awesome.
Yeah. So where do we start? Like, tell me about your journey. I think that's always amazing. The founder journey. Obviously, you shared you're no stranger to technology or, an engineer by training. Tell me how you got started on this path.
If you want the short version, I think the journey really started in the middle of the pandemic. But really, I think the journey for me honestly started much, much early on in life. As a child, I experienced a few traumatic events in my life, and I think from a much younger age, sort of my sense of being was sort of shifted, and I recognized that I became a lot more curious about the human condition. And so I spent a good part of my life, almost half of my life right now in India, surrounded by a lot of spirituality and a lot of, I would say, Eastern ways of, helping solve humanity's toughest life conditions and suffering. And so I learned a ton, but I used to ask a lot of questions and didn't get a whole lot of answers. And so I left India to pursue, an experience here in the US. I call it my 20-year, exploratory journey, and I'm still here in Boston. And one of the significant life events that I went through was the passing of my father. He actually navigated the healthcare system and was diagnosed with cancer, and it was a 5-year ordeal for him. And every time he would go to these healthcare settings, he would just come back defeated. He would just come back like just isolated, and it was almost like a part of his spirit was taken away from him. And that was really hard to see and witness. And being an engineer, a solutions guy, I wanted to do something about that. So, while I couldn't help him when he was around, after he passed, I kind of made it my mission that I want to help people when they're navigating their toughest life situations. And so that's exactly the foundation of our company. We're building solutions that help people that are going through and navigating these tough healthcare experiences in life, give them a sense of support, give them a sense of hope, give them a way to alleviate their suffering without any addictive substances or pharmacological interventions. And as you know, more and more people are choosing non-pharmacological ways to live a better life. And I think we were one of the first few companies that have clinical proof that our solution works, and extremely grateful for that. So that's a little bit about the journey and the history.
Yeah, thanks for that. That's a helpful, powerful background with your journey. Where where did you from the start with your hypothesis to now having the clinical validation? I think this is
Mhm.
a show where hopefully some VCs, healthcare, digital health startups, founders across the audience would probably love to hear some of this, like kind of going from, okay, now we're here at this point, like how did you get from where you were to what you just shared to now a clinical validated tool? I mean, of course
Mm.
you can't do that in 1 minute, forgive me.
Yeah, no, absolutely. I mean, I think it all starts very much with the hypotheses, right? It starts with a belief that, this technology, or this intervention, when delivered through this unique technology, can actually shift and move outcomes. So that was the core hypotheses that we always had in mind. We always knew the power of, tools like mindfulness, breath work, cognitive behavioral therapy, the gold standard of mental well-being, right? Acceptance commitment therapy, even internal family systems. All these modalities exist today, and they've been proven in thousands of studies and been very effective. I think our hypothesis was that while these modalities for treating mental health or even like mild, mental health issues are proven, the delivery vehicle hasn't changed over time. The delivery vehicle is still analog one-to-one intervention. And I think as the world evolves and our attention spans become lower and people choose convenience and self-administration of a lot of therapy, I think we're shifting away from from that pure analog model to a little bit of a hybrid model where people are choosing to engage with their therapists and other support systems, but also using digital interventions to sort of self-administer a lot of these therapeutics. And so we knew that there was an uptake on people using mobile apps, right? But we also knew that there was a fundamental issue with using mobile apps for things like mindfulness because the average drop-off rate is like extremely high. Like you go through the first few days and then you never use the app again. And if you don't engage with something, consistently, you're not going to see the benefits. VR, has this amazing power, or in any immersive technology like VR, has this amazing power to kind of engage not just your senses, but actually activate felt states. And that's the modality that we're leveraging the most with our technology is if we make you feel a certain way, you're going to have the pathways to heal in certain ways. And so, yeah, it was, in the middle of the pandemic that we started this, and then we reached out to a few clinicians in the space who were actively working with people and patients in healthcare settings. And we thought that would be the most ideal place to deploy this technology because they're stuck in these isolated hospital rooms for multiple weeks on end without any support. And that's really what got us started.
Can you share a little more about these, this health systems, what's going on, kind of what that looks
Mm,
like, how you're, I don't know if it's with a certain population, whether it's hospice or whether it's,
mm.
certain, can you tell us a little more about that?
Sure. Yeah, the first patient population that we're, kind of helping support are patients that are stuck in healthcare settings for long periods of time. I mean, it's the use case is very obvious. Like if you ask, 100 people, would you choose to stay in the hospital setting for longer than you need to? Most of them, I believe 99% of them would probably be like, no, I want to go home. So most people just want to get their treatments in healthcare settings and they want to leave. But a lot of times they can't leave because the treatments are, 2 weeks, 3 weeks, 4 weeks long. And so they have to be there. And while they're there, sometimes these patients can't even leave the hospital floor because of the kind of treatments that they're getting. So for our case, our first use case is in the bone marrow transplant space. So these are individuals that are literally getting their entire bone marrow replaced, going through a transplant. And they literally are stuck on an average of 28 days in healthcare settings, no access to the outside world. Sometimes maybe the hospital rooms don't even have windows. And so you can imagine, not just the acute distress that these patients experience, but the high levels of isolation and depression and just traumatic, events. And so I think that's the ideal use case that we're going after. And our plan is to sort of use this as a jumping off point into other, what we call other long-term hospital stays, like organ transplants, lung transplants, hospital recovery after a long, heart surgery, and then eventually go after adjacent markets like senior living and long-term care facilities where also people are stuck for long periods of time. Another interesting market segment has emerged for us based on everything that we've done so far is that the patients themselves have been asking us directly to have access to this product in their homes. And
Mhm.
that's a fascinating opportunity, in my opinion, because now we get to directly impact, the patients themselves without having to navigate the hoops, which is healthcare systems. And so I think we're trying to articulate that strategy of at-home access
Mhm.
this year, and we're hoping to maybe, partner with a couple of companies in that space to again improve access to our technology to more and more people.
I know I've seen some that do with dementia. That seems to be a huge opportunity to help with just anxiety, with all the different things that just, and then the caregiver burnout. If you were able,
Mm,
I know I could see, I could have never imagined my father. He's got dementia, but having a VR on him, but we've just he's just transitioned to a memory care, and he's doing really well with the activities, the socialization, and I would have never thought he'd be enjoying those sort of things connected. And so I know there's a lot of evidence for this in those sort of settings for that population of dementia. Is that an area you could see in the home care setting and also assisted living in that population?
Absolutely. I mean, caregiver burnout is absolutely a real issue. And I think there's a saying that caregivers pretty much are the next patients because they themselves go through such a hard, levels of suffering and extremely high stress that's really chronic more than acute. And so I think we are also building tools to help support caregivers in an at-home setting. And a lot of the interventions that we've designed can pretty much be translated for use not just by the patients themselves, but also their caregivers, right? Because we do have a specific version of our product that's applicable for your disease area, but we also have a general version that anybody can really use to just better get a better grip, I guess, on their psychological health. And so that's the at-home piece. But yeah, I mean, memory care centers, long-term care centers, we definitely are interested in exploring those markets. I
Mhm.
think they do have a scheduled list of activities that they typically have on the roster on a daily basis, and so we're trying to figure out, how do we best support the folks that are working in these locations in a way that doesn't create additional burden for them when deploying, technologies like ours. So we're in the process of better understanding, this market and the user experience in this market and who's going to use it, who's going to buy it, who's going to, be responsible for facilitating an experience, because all these pieces are important to connect in these settings before you actually go and commercialize your technology. So we're still in the exploratory phases in these markets, but it's definitely on our radar.
And with it being clinically validated, I imagine some of the things with the capabilities from lowering blood pressure, indicators on stress, and whether it be biomarkers. I mean, it can. I mean, there's really a huge space here that you can go. And I know you're a startup; you can only do but so much with the resources.
Mm. Yeah, I mean the opportunity, and this is why again, this is not a 2-year mission, right? This is really more of a 20-year mission because
Mhm.
whereas initially we are starting out in this niche sort of use case, the goal is to always kind of find a wedge in and then figure out an expansion over time, right? Yeah, we do believe that the use cases, 5 years from now will be a lot different. To give you a quick example, we are chatting with a researcher and a person who's very much active in the transportation space, on helping effectively transportation workers deal with the stresses and the trauma of their just daily jobs because they witness so much, potentially horrendous situations while they're navigating their jobs. And so I think that's an interesting market too, because again, anywhere where people are exposed to extremely high levels of acute stress, or maybe even chronic stress, but also even traumatic exposure to certain, life-threatening situations can leave an emotional scar. And so, how do we support people when they're most vulnerable, so that these scars later on don't go unhealed and create further downstream issues? So that's also where something we're exploring.
And what are you finding with the usage? I imagine it can be on, and you can find benefits in less than 5 minutes, all the way up to 45 minutes. Tell me about if there's a dose response sort of with different.
Mm. Yeah, it's a good question. We haven't officially measured sort of a dose response, but we have put people on our quick 6-minute demo experience, and you can visibly see a shift. You can visibly see a very clear, visible shift in their psychological states. Whereas before, they may have showed up, before a demo with a bit more of an activated, high sympathetic state. After a 6-minute demo, it's almost like we were able to sort of gently nudge them into more of a responsive, more calm and centered state. And so we have seen that anecdotally after just a 6-minute demo. And we don't have any official measurements on the dose response yet, but that is something we're looking to sort of figure out, that what's the optimal amount of dosage that you need to use this for. And our vision is that we don't want you to use this as a crutch, because again, any technology potentially could also become a crutch. And our plan is that, how do we get you to use our technology, let's say in the earlier stages of your journey, a little bit higher number of times, and then over time, as time goes by, we want you to sort of lower that dosage, so that you tap into the built-in skills that you're developing while you're using Novobeing. And over time, you don't have to rely on it as much, but you can always come back for like a booster shot, right? And it can always engage in an intervention again if you'd like, or maybe if you're navigating a different situation down the line, and you want a specific intervention that we've developed just for that situation that you're navigating, we might be able to put you back on another sort of program. So that's our plan.
So for anyone that's hearing you right now as a startup, where are you right now with your raise? Like, what are some of the things you're really actively looking for in the next 3 to 9 months?
Mm. So where we are with our company is we're a seed stage company. We've raised a little bit over $1.1 million. We recently got funding from the American Cancer Society, which is the largest cancer nonprofit in the country. So extremely happy to have their support in our mission. Um, it's not every day that you get investments from organizations like American Cancer Society. So I think we're looking forward to the next 3 to 6 months to really figure out our market and go-to-market strategy. We have clinical proof. Our product is ready. Our product resonates with people. We've received extremely high user scores, engagement scores. And our adherence rates, our completion rates are over 70%, which is extremely high for a digital health intervention. And so now that we have this, hoard of data, we're just looking to commercialize our technology in the right settings, in the right contexts. So what we're looking for is definitely partners and people that are on the mission, sort of to support people as they're navigating tough health conditions, and finding some opportunities to be able to work with them, so we can expand the use of our technology. It's always great to talk to investors, and we definitely are in the market for raising a round. We're not, jumping on it yet, but I think we're looking for a mission-aligned, right partner to help us support on this in this journey, because I think the mission becomes very big and important as we start hitting these milestones, and we want to make sure we have the right partner.
Yeah, that totally makes sense. The partnership, the alliance, and I think that says a lot about you as an organization. That some organization like the American Cancer Society has said yes to you, and you're doing great work. So you really want to make sure you find the right group. What what is something I think people that are hearing this, you have healthcare leaders, payers, providers, pharma across the board, founders as well, other health enthusiasts. I'm thinking, about you as a founder. Like, what are you doing to be fed, to build your founder community? Kind of
Mm,
what, like, that always fascinates me. Like,
mm.
your workout or whatever you're doing offline to build your keep your vision alive. Where do you get fed,
Yeah, no, it's such a great question, which is often unaddressed, I think, in the startup world. So thank you for asking that. I genuinely think the company that you build is just as, there's a direct correlation to the resiliency and the strength of a company to the founders and the founding team. It's just, it's just, there's no doubt about it. And for me personally, I actually tell people I started the company, and initially I was sort of directing, the and carving the vision and the mission of the company and shaping it to be better. And what's happening now is now there's this reversing happening where the company and the mission is making me a better human, a better founder. It's almost like, the journey is teaching me a lot more lessons to be physically better, emotionally stronger, spiritually connected. And so some of the practices that I routinely engage in, it's pretty much a daily habit at this point, is definitely movement, breath, and just a sense of carrying a general sense of gratitude, no matter how tough the journey gets, because the founder journey is a roller coaster. You're going to have massive ups and downs, and over time, you just got to figure out how to ride these waves of ups and downs. But if you have a sense of, recentering and balancing activities through physical movement, through connecting to your breath, through, carrying this sense of gratitude that you get to work on this mission, it's extremely grateful for that. I think that keeps me going. And then obviously sleep. Sleep is extremely important. Do not compromise on sleep if you're a founder watching this. And then just again, healthy food. I think the basics. You don't have to,
Mhm.
make it extremely complicated. Just, stick to the basics. Get enough sleep, get good food, which is fuel. Move your body, have some sort of a grounding practice, whether it's meditation or breath work. And then yeah, just carry a sense of general optimism and positivity, because the world, will always find ways to make anything negative. But if you carry this sense of positivity and light within you, then nobody can, turn that light off.
Yeah, I love that. The gratitude is so important. The movement, pickleball, I try to do. That's my thing. And
Yeah.
I found I saw this study how tennis is in the top for longevity, and I'm like, well, when is pickleball going to be added? I don't know, but I need to probably do some more movement yoga. I need to be better at stretching. What is that movement that you do? I'm sure people would love to know if you want to share.
Yeah, so I have a mix of practices. So I never stick to just one thing. So there's definitely running outdoors and
Hmm.
or hiking in nature.
Hmm.
There's weight and
Yeah.
resistance-based training, and then definitely stretching and yoga. Like every now
Hmm.
and then, I would just take a random class and just kind of keeps things, a little bit more flexible and supple. I think the key thing is to, just like everything else, add diversity to your movements because
Hmm.
I think that is very important because you don't want your body to just move a certain way. You want to kind of add a sense of diversity and like, give give it the give it that condition to sort of navigate different terrain, whether it's through hiking, walking, running, maybe jumping off, a few like unstable rocks, which can
Hmm.
be also very centering for the mind because your mind's extremely focused while you're
Hmm.
doing that. Obviously practice safety and all of this,
Yeah.
this stuff. That's important. That's prime, absolutely at
Hmm.
top of the list. But yeah, definitely like try and move, just even like random, put on a playlist and dance in your office, like no one's watching. Even that considers is considered healthy movement. So, sometimes I even do that.
Yeah, well, I love you're saying all these things because you are Nova Being. You know, your Nova Being is the center of what you're doing. So if you gotta walk the talk and do the movement, do the movement. And so so important. As we're kind of coming towards the end, I'd love for you to share a little more about yourself and what you'd like to share as you're here today. I really
Mm.
really appreciate you coming on. This has been such a great conversation.
Yeah, no, thanks, Michael, for having me. I think the first thing I'd like to share with just the audience and the world in general is it's also on our t-shirt here. It literally says just breathe, right? It's important, in my opinion, to kind of bring that awareness back to your breath because I know this sounds a little bit sort of out there, but the breath truly is the bridge between your mind and your body. And a lot of emotions that we're all carrying in our world today, given everything that's happening in society, a lot of these emotions are actually stored in the body. And if you don't build these, what I call pathways to peace, these bridges to your body, then you'll forever be always in your head. And nothing wrong with that. But if you again use, if you become too heady, it starts to kind of create a sense of disconnect from your body. So I think definitely use the breath as an anchor and surround yourself with, again, people who are looking at different ways to sort of improve their lives, whether it's even if it's happening at 1%, every day or every month or whatever, like just surround yourself with people who are optimistically looking at the future to be like, yeah, despite everything that us collectively as a society are navigating, I as a person am still hopeful that we get to create a better future, not just for ourselves, but for all the future generations. And keep that in mind because this is often sometimes I don't say it to people, but in my opinion, you taking care of your mental health does not just benefit you. It benefits everybody around you. It might even benefit future generations because you might serve as an inspiration for somebody, 20 years down the line. Maybe it's your kid, your grandkid, maybe your nephew, niece. They might look at your journey and be like, I that inspired me. And maybe that will start the shift for them to actively, take charge of their health and shift from what, has become more of a reactive way of dealing with our health to more of like a proactive way of living. And I think that's the message I want to pass back to the world.
I think that's such a powerful moment of a powerful share. I remember my aunt always flipped her slippers up, and that was reminding her to be grateful every day and her prayers and that kind of those powerful habits are totally generational. Whether it be an aunt that always gave me that letter, that note, that reminder, my birthday, or whoever. Actions are powerful with love and kindness. So I think you're really absolutely right. And this gratitude and it's great to hear it from a founder where your company is really embodying alleviating suffering really in healthcare. And so I'm really super glad you've been able to come on, have you on, and congratulations. Before we close, Sid, just how can someone find you? Tell us real quick about that, your website, how they can find you, connect with you.
Yeah, you could always go to our website. It's at novobeing.com, novobeing.com, or you can just email me. My email is Sid, my first name, at novobeing.com. Um, Generally, I'm very good at responding to emails, but every now and then I would miss, the occasional few. So please be persistent at, with your follow-ups, and I'm happy to hop on a call with anybody who's interested in, just learning in general about the founder journey or just wants to, be curious about building something in the whole healthcare, mental health domain.
Well, man, it's been awesome to have you on. Super excited. Looking forward to your success. Want to hear more. Hope we can have you on again too.
Yeah, well, thank you so much, Michael, for having me. And again, kudos to you for all the beautiful work that you're doing in our world and community, and keep at it. And I think the more people, kind of hear about stories like ours, I think the more, potentially inspiration that we kind of spread. And I think that's what the world needs right now.
Absolutely. Awesome.